Hi, welcome to Understanding Medicare, presented by Conifer Consulting. I'm Jeff Lindgren, Senior Account Executive here at Conifer Consulting, and this slideshow is just to help you understand Medicare better. We may have already had a meeting, and this is going to tie everything together, or this is before our meeting, and you can have some things to understand what we're going to talk about more thoroughly. First thing is open enrollment period, October 15th to December 7th. This is when we can change your drug plan and we can change your Medicare Advantage plan. Now, when it comes to Medicare supplements, Medigap plans, we can change those anytime throughout the year if you can pass health questions. In New York, we can change anytime without health questions. But states like South Carolina and North Carolina, we have to answer health questions for Medicare supplements, but we can change those whenever we want. This annual election period, October 15th to December 7th, is to change your drug plan or review it. We might not need to change it at all. And also, it's the time where we can switch you to a different Medicare Advantage plan if you're unhappy. Here's your basic Medicare supplement plans, A through N. I know it's confusing because Part A and Part B, but forget all that. The supplement are also letters. We talk about the G and the N mostly, but all these are ones we can consider. These are all regulated by the government. So Plan B with Aetna is the same as Plan G, or excuse me, Plan B with Aetna is the same as the Plan B with United Healthcare. They're all exactly the same. So that's regulated. And we could talk about these more in depth during our meeting. Your Part D is your drug plan. It's pretty easy to remember. D for drugs. This is your prescription plan like we talked about. We can look at this and review this and change this every annual election period during October 15th to December 7th if we want to. We can also keep it the same. But this covers your prescription drugs through Medicare. Reeve and I, we run these through the government system with your specific formulary. And then after that, we can determine which drug plan is best for you. Now, the Medicare Advantage Plan, Part C, it combines Part A, as you can see here, Part B, and Part D, and then it's called Part C. I know, very confusing, but it's broken down pretty easily here. It's basically a combination of everything. These are going to have lower premiums. It will have a network, however. You are locked in for the year. There's copays and certain deductibles as you go. I consider it like a la carte health insurance. You kind of pay as you use it. Obviously, if it's free, if it's low premium, most of them are zero premium, there's going to be a catch to it. And the catch is that you kind of pay as you go. So an MRI is this much, an X-ray is this much. If you go in the ambulance, it's this much. It's not as simple as the Medicare supplements. And we can talk more in depth about this during our meeting as well. Which to choose? It really depends on your specific situation, but here's a couple pros and cons or a chart that lets us determine which is best for you. The supplement, the Medigap, it's going to be higher premiums. However, there's going to be no network. No referrals necessary, and they're going to be covered everywhere in the U.S. You also have some certain supplements. You have some out-of-country benefit, which is nice if you travel abroad. These are going to have, there's some plans that there's only a $200 deductible, and then it's 100% coverage the rest of the year. We can get more in depth than that. Versus the Medicare Advantage plan, like we talked about earlier, lower premiums, but has copays. It's going to have that restricted network or that where you have to stay within a certain hospital and doctor network. You may need referrals. And it does, here's a nice pro, it does have some extra benefits. It could have some dental. It won't be comprehensive. It'll be more preventative dental, preventative vision, hearing. It might have a fitness benefit as well, which is nice if you enjoy working out at a local gym. So speaking about IRMA, so IRMA is based on your income. If you make under, let's say under 88,000 as an individual, you don't have to worry about paying an upcharge. If you make under 176,000 as a joint, as a married couple, you don't have to worry about an upcharge. However, if you make the income based in these brackets here, so let's say 222 to 276, if you make within that range as a couple, you're going to pay 297 for Part B instead of the 148.50 that most people are making. So this is something to consider, and this is something Reeve and I can talk to you about and kind of guide you through as we get there. Here's the Part B Part D IRMA charges. So you will have an upcharge on your drug plan as well. So say your drug plan's $20 a month. You'll pay an extra $12.30 if you make between 176 and 222 as a couple. So there is an upcharge as well. And we can talk more about this and guide you through it and help you. And there are ways to appeal your income if it changes on a yearly basis because you're a 1099 employee or maybe you made a big sale on a house and your income was higher. So we can talk more about this as we get further on in the process. The Medicare Give Back benefits. This is a new program. We'll really get into this if you're interested. In certain areas it works. In certain areas they don't have it. So basically, it's a give back benefit. It's for the Part B premium reduction. So that $148.50 or whatever you could be paying, it does give you some money back. How do you qualify? You got to be a Medicare beneficiary enrolled in Part A and Part B. It's most people. And you have to be responsible for paying your Part B premium. And you have to live in, this is the big key, you got to live in the service area of a plan that has chosen to participate in this program. So not all zip codes do. So each person's situation is different, and we can and we will go over this if you want to bring it up during our session. Here's my contact information, Jeff Lingren, jeff@revolno.com, and then our phone number here. So please reach out to us if you need anything. If we've already talked, I hope this kind of tied everything back together that we talked about. And please, and thank you again in advance for all your referrals as well.